Hi, I'm Dr. Butts, Doctor of Dental Surgery, and we're going to talk about what's it like to be a dentist. What's it like to be me? Hi, my name is Jeffrey Butts, and I am a Doctor of Dental Surgery, and this channel is all about health and wellness for you, from my perspective for you, right? So today we're going to concentrate on what it's like to be a dental surgeon. What am I going through while I am serving you? All right. Number one is I am not nervous, okay? Not nervous at all. At all. Number two is that I am very highly concerned about you. Want to make sure that you're okay. And as long as you're okay, we are okay. All right, so let's talk about maybe doing an extraction. Now, there's multiple reasons for doing an extraction. Sometimes it's a tooth that got some decay in it, and the decay went all the way down the root of the tooth, beyond the bone that holds the tooth in, and now the tooth is no longer viable. You can't do anything for it. You can't do a filling, can't do a root canal, can't do anything to fix a tooth, and now I call it a tooth donation. Now you're gonna have to make your tooth donation. And with that donation, that means that you're gonna leave me the tooth. You're gonna come in, you're gonna have the bum tooth. I'm gonna keep it. I'm gonna dispose of it. No, I'm sorry, you can't take your tooth home because it becomes, or can become, well, it is, biohazardous waste. That you could actually make a bioweapon, a biohazardous weapon with what you got going on in your mouth. So yes, it did need to come out. But what am I going through when I'm taking care of you? Well, this is what I'm going through. I am making sure that you are perfectly okay. The worst part, if there's a worst part at all, is just getting you numb. And I have had a lot of training now in anesthesia techniques, and I feel like I got it down. Also because I had an amazing oral surgeon when I was in dental school. My oral surgery teacher took out all 4 of my wisdom teeth at the same time, and I was awake for the whole thing. I was completely terrified because I'd never actually been awake to get my teeth out before. I was when I was a kid, before I got some braces at the time. But yeah, he showed me a technique, and I use the technique on everyone, and it seems like we're able to get there. But yes, if there's a worse part of it, yes, it is getting you numb. But if I can get you past that part right there, I feel like I've done a great job for you. And then, once you're numb, all you gotta do is just relax. Just hang out, let me do my thing for you, and get the tooth out. All of the tooth, nothing but the tooth. So help me God, all right? So, what am I going through? All right, so sometimes some teeth are harder than other teeth. Yes. Sometimes those hard teeth, they make me sweat a little bit. Why? Because now you got me at work. Now I'm working, okay, to get this bum tooth that you brought me out, and you're supposed to be comfortable while I'm working really hard for you. That's okay. I'll do it. As a matter of fact, I do it every day I'm at work. So, with the hard teeth, the only thing that makes them hard is maybe you get uncomfortable. Maybe you say something like, If you say, well, that means there's something wrong. There must be something wrong because you made a sound, right? Are you saying that something's hurting you? You're feeling pain? And then here's the answer that I get sometimes, and this one is a good answer. No, I'm fine. Wait, what? You're fine? No, I'm okay. I'm all right. But you made a sound. Yeah, I made a sound. All right. Is it pain or pressure? That's my question to you. It's just pressure. I don't feel pain at all. Really? Yeah, it doesn't hurt at all, Doc. Go ahead, Doc, go get it. Okay, all right, here we go. All right, and I'm going again, and what? Are you okay? Yeah, I'm fine. Anyway, those little sounds right there, maybe because I'm an only child, maybe because I'm very sensitive, those sounds that you make They make me go a little slower. Why? Because I think that there's something wrong. Or maybe you're not feeling as comfortable as I'd like you to feel, and now you got me going a little bit slower. No problem. Maybe I need some more anesthesia. Maybe I need a little bit more time. Does not matter. What matters is that you are comfortable. As long as you're comfortable, we're out of here. Now let's take another scenario. And I feel like women seem to be way better patients than men. It seems that way. Like maybe because they have babies, or they can handle that stuff, or they can handle heartbreak way better than me. But I feel like women actually handle dental surgery way, way, way better. And I might get the occasional, and you know what that does to me. It makes my back go up, all right? And sometimes I'm working and I get a little hot, get a little perspiring. Probably nothing that you can see. I'm probably not glistening on the outside, but I think my back might get a little bit of perspiration. I'll say perspiration to be gentle, but no, maybe it's a little sweat. Why? Because I'm working hard trying to get a tooth out for you so that you are comfortable. But it's okay. That's my gig. This is the thing that it seems like I was born to do this. It seems that way. Because seriously, who wants to be a dentist? That's a weird one. Like the little elf in the Santa Claus kid show that was like, I want to be a dentist. I was like, really? That kid is like the weirdest guy out there. I mean, like, why does he want to do that? But for some reason, some kind of way, I got to do this, and I really do mean that. I get to serve the public on a daily basis. I mean, it is a joy, joy, joy for me beyond. And once we get the tooth out, once we've done what me and my assistant and I, once we have gotten the tooth out for you, well, first of all, I feel so much better, okay? I like to drop the mic. I like to, okay? And if I get to do it really fast and you don't even realize that the tooth is out, what? Are you kidding me? That's the best. And now my day has gone from, man, this is work, to I'm just doing my thing, man. I'm just in here, you know? So I would say, try to take care of yourself, right? And I'm gonna do another video on what you need to do in order to avoid dental cavities. I'm gonna do a video on post-op instructions that you're gonna need after dental surgery. That video is coming up. But right now, I just wanna give you my perspective. So when you come to the dentist, right, and you're like, is this guy all right? I'm all right, I'm okay, okay? But in me serving you, I gotta know you. My mentor said, never treat a stranger. And that is true. Do not treat a stranger. I don't want any surprises. So I go over your medical history, even though you wrote it down. Yes, I have it in the chart, but you know what? I really want to hear it from you. So I ask all the time, are you taking any medicines and medications? And depending on that answer that you give me, I know what medicines you're taking, if you're taking them on time, why you're taking the medicines, what chronic illness that you have going on. I ask, are you allergic to any medicines or medications? And depending on that answer, I know not to give you this particular drug as a post-op drug or a during the op procedure drug. I'll know what to do. And then I'll say something like, do you have any liver or kidney problems at all? Yes, there's a reason why I'm asking that, because some of the medicine that I'm giving you, it has to be metabolized by your liver and your kidneys. And if you have any problems, I want to know what those problems are so that I'm able to choose the right medicine for you. I'll know how much I can give, what my limit will be. And then I'll ask something like, have you been hospitalized in the last 5 years, an overnight visit for anything, any reason at all? I'm asking this question because, again, I'm getting to know you. There's not going to be any stranger danger going on. So if you've been to the hospital, maybe it was a car accident, maybe you had a heart attack, or maybe you had a kidney stone or something like that. But these are the things that I need to know. And you know what I really, really want to know? I really, really, really want to know if you know what your blood type is. Now, you know, I can't seem to get anyone to agree with this blood type thing with me. Some people agree, but I feel like it's not enough. But let's get it like this, okay? I feel like if you know what your blood type is, I have a sheet on my website, campcreekdental.com. You can go to that website, you go to blood types, it's A, B, AB, or O. Those are the basic ones. And then it's positive or negative, but I don't think that the positive or negative next to the letters really has anything to do with anything. Now, at this time, I don't think that it does. But on the list, it's what you should be avoiding and what you should be eating. So if you know your blood type and you know what you should avoid and you know what you should eat, but you're not, well, the reason why you should avoid some foods is because I believe it can make you inflamed. And this inflammation is going to make you more acidic in your body. And an acid environment in the body makes it so that the bad bacteria can grow and prosper and live and do all of these really great things for them, but not for you, not for you. And then if you know what you're supposed to eat, well, you can be eating what you're supposed to eat, and you'll have more alkalinity. It'll be more basic in your body. It'll be much easier for me to have the anesthesia work for you. It will be so much easier for you to fight off bacteria and disease, but this is the health and wellness channel for you. So that's just the first part, is food. I'll ask you, did you get a good night rest last night? How'd you sleep? I'll ask you, do you exercise? You get any exercise? What kind of exercise do you do? I might ask you, how's your detoxification? Yes, I'm talking about bowel movements. Yes. Are you having regular bowel movements? Because that's what gets the toxins out. And then I'll ask you maybe one more thing, like, you meditate? You read the Bible? Do you pray? I'll be able to tell whether you have a good attitude or not. I'll ask if you take time for some gratitude. I'll ask you if you have some forgiveness in your life. All of these things, food, sleep, exercise, detoxification, and mindfulness behavior, are what I want to know so that I can make my own assessment of you. And I'm also collecting data in my head. Sometimes I write it on my patient's chart. And I'm trying to get it together so that maybe I can prove or disprove that eating for your blood type is actually good for you, or like what so many people say to me, it has nothing to do with anything. I don't think so. I don't think so, but maybe. We'll see over time, because now we've got all types of ways to test and see. And then I also say, take your bad part of your list, take your good part of your list, do a food allergy test. Check it on that, see how that goes. That's just my belief. So anyway, once I have gotten to know you, and maybe through my questions you might know that I actually really care about you, I think we're ready to get you numb. Oh, I also take your blood pressure. I do want to know what your baseline blood pressure is. I take that for all of my patients that I am going to do a procedure on, give some medicine to right at the time. I mean, I really want to know that, because where are you? Our blood pressure can tell us, or your blood pressure can tell you, or tell me, a lot about you, and what you might be eating, what you might be doing, what you might not be doing, because your actions are what make you who you are, your unique self. So I want to know who you are. That's it. So now, once I've gotten to know you, I, for the most part, know exactly what I can do, what I cannot do, to be as safe as possible, to do something like an extraction, something like giving you some medicine by way of injection, so that I know what kind, how much I can use. All of these things, they all go together for me to make sure that I am doing my best job for you. Because what's it like to be me is just simply being a public servant, serving one person at a time. That's all I need. And in order for you to understand what I'm looking for, I am looking for the best for you. Even if you're not looking for the best for you, I am. I can't do anything more than lay hands and do what a dentist would do in whatever procedure we're supposed to do. I can't do any more than that. I can give you my heart. I can give you some suggestions. I can say some things that hopefully will put you in a good direction, because I do want my words to heal. Even words can heal. And if that is something that's healing to you, then yes, I've done my job. I want to show up. I want to show out. I want to show off. I do. I want to be so good that we weren't there that long when I was touching, and that it was a nice, easy procedure. I want you to have a nice experience when you come to the dentist, because seriously, who wants to go to the dentist? Who wants to go, right? I don't know anyone. Well, actually, I know a lot of people that want to come here now, but maybe not in the beginning, because they're like, who are you? And this is who I am. I am your dental surgeon, your public servant, Jeffrey Butts. That's all I really wanted to say about that. That's what it's like to be me when I'm working for you, Thank you so much for watching. If you found any value in any of these things that I've said for you, please, please, please share it with a friend. Tell a friend, and leave a great comment. Maybe tap that thumbs up button. And thanks so much. I'll see you next time, or I'll see you at my office.